Okay. Hi, Rebecca. Thanks so
Hello.
much for joining me. So, your
Hi.
name is Dr. Rebecca Corney, and you are a counselling psychologist.
Yes.
And here we support people who are in cardiac recovery. So, they might have experienced either a sudden cardiac arrest, or maybe a heart attack, or maybe even open heart surgery. Sometimes people struggle following a really significant surgery like that. And I was wondering, what challenges does a counselling psychologist in particular support people through?
Okay. Well, I think that psychologists can be interchangeable, a counseling psychologist and clinical psychologist. Just so anyone listening might understand that both of those trainings would enable people to work with someone who might have a heart condition or has been through a surgery or experienced a cardiac arrest. Probably the dominant um, way that psychologists could intervene would be in providing emotional support. And that could look uh, in different ways, providing that support. So, first of all, lots of people, and I won't share the statistics necessarily, but a predominant portion of people who've experienced a cardiac event can experience feelings of anxiety and also low mood or depression. And there might be anxiety about what has happened to them, but it also might be anxiety about the future or changes in their lifestyle or what the future might mean or the fear of something like that happening again. But also the low mood with what has occurred and again, life changes or a shift in someone's identity. So a
I've heard this,
psychologist,
I've heard the number 40%. I think I've heard that 40% of people who've experienced a cardiac event go on to have emotional difficulties. I don't know if you've heard that number.
I have actually, I've heard, yeah, around that number, 40%. I think it rises slightly higher for people that also might have experienced trauma through what's happened to them. So there's the anxiety and depression, which might have occurred as a result of the heart cardiac event. And also, there might be people who were already experiencing worries in their life before that happened. And that could be because somebody knew they had a heart condition, or it might be that they were experiencing a lot of life stresses that could have been a factor that led up to um, what happened to them. And that could have been in terms of their lifestyle, like maybe people were eating unhealthily or not exercising because they were feeling depressed. So intervening at that level, and providing different sorts of therapy depending on what the psychologist and the person think would be the most helpful way to work together. So psychologists are most often trained in at least three different types of therapy. And usually they would tailor the therapy according to the person. But it may also be that someone's working in a particular service where that service sort of chooses how their clinicians would work with someone. So by that, I mean that they would provide cognitive behavior therapy, for example, or acceptance and commitment therapy. And those are just different types of therapy that enable the work to be done. And most of the time, the research suggests that it doesn't make too much difference what type of therapy it is. The most important component is the therapeutic relationship, is
Mhm.
the relationship one builds with your client. So that's the anxiety and depression. And then there's the trauma.
So I suppose, would an advantage be with a psychologist because they're trained in different approaches? If one approach doesn't necessarily work, then the client might say, "Can we try something different?" Would that be an advantage?
It could be an advantage. And I think usually it would be collaborative. So that's something that the psychologist and the client would discuss together, like, this doesn't seem to be working, or let's shift our focus of work. Because as I'll come to suggest, there are lots of different potential areas of focus, and the psychologist and the client will decide together which area of focus to work on first, And that might shift, it can evolve and it's fluid, so it doesn't have to be so set in stone. And then someone might have, experienced a significant trauma by the event that had occurred, either a sudden cardiac arrest and the trauma that is associated with that whole event. But there could be lots of aspects to trauma, including the time spent in hospital. We know that spending a significant amount of time in ICU, especially someone who's come into hospital unconscious and then may eventually become consciously aware of their surroundings and not be sure how they arrived there, or have had, a memory difficulties because they don't remember the event itself. So hospital itself can become traumatic. And then the trauma of going back home and lifestyle changes that might be required. So a psychologist can intervene at the level of trauma, and there are lots of different, again, therapeutic models that psychologists could practice. So one might be, again, cognitive behavior therapy for trauma, but there might be other evidence-based interventions like EMDR, which stands for eye movement desensitization and reprocessing. And that is an evidence-based intervention for people that have been through a significant trauma.
Yes, yeah. I've heard a lot about this, and family members of mine have gone through the EMDR, found it really helpful. Can you
Yeah,
explain a little bit about what EMDR is, how it works, and when you might find it helpful after a cardiac event?
yes. So there are different theories about how it works, and there isn't one truth, if you like, about exactly how it works. But what we think is that when we go through a trauma, the brain replays the traumatic event in a way to protect us from that event happening again. So it's our brain's way of protecting us from harm. And what happens is that when our brain is trying to protect us from harm, it might replay the event through flashbacks, or we might hear a noise or smell a sound or have a memory in our mind. And that triggers our body to respond as if the danger is happening in the here and now. So our body would go into this panic mode. So it's our sympathetic arousal system gets switched on, which is our body's natural way of protecting us from harm. But that can happen when we don't need it to be switched on. So it's our body and our brain re-experiencing the event in the here and now rather than remembering the event without the associated body symptoms, if you like. So, what the EMDR does is it places the memories into our long term memory. And so, if we do hear a sound or we do, think about the event, we no longer re experience it as if it's happening right here, right now.
Mhm.
So, it uses what we call bilateral stimulation. So either hand movements, or you could use tapping or on the legs, or even using lights like an audio to use this bilateral stimulation. And it's a protocol, so it follows a very particular method. So anyone practicing EMDR would follow this. It's an 8-stage protocol, and you would build that slowly and ensure that at the beginning you create a safe space so that if somebody does become distressed during the processing, they are able to soothe and calm themselves. And you would work with very specific memories. So you would choose a particular memory to work with that's often the worst part, and think about how it makes you think in the here and now. So it might be, I feel unsafe in the here and now, but working on that memory. And it's extraordinary.
Yeah, yeah. Really surprisingly effective, isn't it? I remember
Yeah,
being so surprised at the results. And it's not that you forget the memory necessarily, but you just don't recall it and with as much panic and with as much, doesn't feel like it's so present. It just feels like more of a distant memory.
That's correct. So again, just to reiterate that when we hear a sound or something triggers our body to respond as if that danger is happening in the here and now, the EMDR helps us to remember the event rather than re-experience it as
Okay.
if it's happening in the here and now.
Okay.
Yeah. So we've talked about trauma a little bit, but the psychologist can also help with what we call behavior modification. So because somebody has experienced a cardiac event, or they might have been diagnosed with a heart condition, they may need to make some lifestyle modifications. And there can be all sorts of challenges around that. But psychologists are trained to, think about links between behavior and thinking and mood. And so that's something that a psychologist can help with, to shift someone's behavior, create new, healthier habits. So that might be in terms of, dietary changes, or helping someone to increase physical activity, or committing to medication. But for some people, that might be a big, big shift in lifestyle
Mm-hmm.
and values.
Mm-hmm. And also, I
Uh,
think getting used to maybe a lower level of functionality after a cardiac event, and you can't quite manage what you used to be able to. And there's an aspect of maybe grieving that experience and grieving what you could have been, what you were. Maybe that's a piece of the acceptance of how your new normal, so to speak.
Yes,
Um,
I think so. It fits with sort of our shifts in identity
mm,
and values, and how we see ourselves, but also how we're seen in the world. And those are quite as existential issues,
mm,
I think. But yes, that's another area of focus that
mm,
someone might wish to be considering and working on.
mm,
Um, People who've experienced a cardiac event, especially a sudden cardiac arrest, may also experience cognitive changes.
mm,
They might have no recall of the event itself that happened to them, but they might also struggle with, poor concentration, thinking skills, new learning, um, and a psychologist, particularly a neuropsychologist that's involved in rehabilitation, can help someone with strengthening their cognitive skills and strengthening their new learning in those areas. So just wanted to mention that as well, because that's something quite specific
yeah.
too. Um,
So would that would be a counselling neuropsychologist or any type of neuropsychologist?
So, a neuropsychologist traditionally has been a clinical psychologist who's gone on to do a further training in neuropsychology, but that training is now open to counselling psychologists. So, it could be either, but it's quite a specific training, and one would need to look particularly for a neuropsychologist because it's an additional qualification.
Yeah. Okay.
And I just wanted to mention something about um, managing stress,
Hmm.
because I suppose we hear a lot that, people with heart conditions may say, or, my doctor has said that I need to manage my stress levels better. Um, and that's something that a psychologist could help with as well, whether it's through mindfulness, meditation, relaxation techniques. There could be lots of different possibilities, but that's another option.
Mm. And that would also probably help with anxiety of recurrence and just anxiety, especially if people have an internal defibrillator, the feeling anxious about it firing or just having another cardiac event that
Absolutely.
oh,
Absolutely. And sleep, which is really crucial for our mental health and our well-being. Someone who's feeling anxious or even is depressed might have trouble sleeping. So working on some sleep strategies as well, I think would, is a possibility.
okay. And are there any times where you would advise somebody not to see a counselling psychologist and to find support from somebody else?
I think that's an important question, because we never exist in isolation. We are relational beings, so we find ourselves either in our families or in other types of systems. And especially if um, our, the cardiac condition is impacting on the wider family, it could have been, somebody who's witnessed the event or has helped with CPR or, is struggling themselves. That's when maybe a family therapist or a couples therapist, because of the impact on a relationship, would be really, really useful for somebody, and they could access a family therapist through, the family therapy network.
Mhm.
So yeah, I would suggest that. Um, Additionally, there are times when psychologists might not be trained in some of the trauma treatments, like I mentioned, the EMDR. That's an additional training. So if that could be an area of focus, then it might be decided between the psychologist and the person that, I think actually it would be really useful for you to focus on EMDR, and how about you go and see an EMDR practitioner?
Because not all
Sometimes
psychologists, not all
not all
psychologists are EMDR practitioners.
correct, correct, and not all psychologists are trained in neuropsychology either.
Mhm.
And most psychologists are not family therapists. So I think those would be the three main times when, yeah, you would discuss it with the person.
Okay. Okay, great. Oh, and a final question. How do you go about finding a counselling psychologist if you know that you need the support? You're a bit clearer now on who to look for. How do you find a counselling psychologist?
It's such a minefield because I think
Yes.
there's so many different
Complicated.
names for therapists and psychologists and counselor, and it can be really, really confusing. So I would always encourage people to look for an organization that is an umbrella organization for psychologists, where they can find a directory of people who are qualified. And that would be the British Psychological Society, BPS uk.org, I think. And they have a directory of psychologists. So you can look up a psychologist and you can input speciality, cardiac, or depression, and you can filter what area of the UK you're looking for, and it should come up. Additionally, I believe the British Heart Foundation, on their webpage, they have a whole bunch of really useful resources, but they also have a resource page on finding help.
Hmm.
So I would encourage people to look there. And finally, if people want to go through the NHS, you can always self-refer to NHS talking therapies or
Hmm.
go to see your GP, and the GP can also make a referral, but you can self-refer to NHS talking therapies as well.
I believe
Some
in the UK, if you've experienced a significant time in the ICU, they often do offer emotional support, or maybe you might have to inquire about it, but they usually do offer
They
psychological.
usually do. There's a specific name. It's an umbrella term. Sorry, I'm just checking. Yeah. It's called post ICU syndrome, which I think is such a horrible phrase. But it's specifically for people that might be struggling with some of the impact of spending a long time in ICU, particularly people that have been on ventilators. And often a hospital cardiac team will offer that support, psychological support. Some cardiac teams do have access to hospital psychologists, particularly health psychologists. I ought to have said that as well. Health psychologists are often embedded in hospitals to support people that have physical health difficulties. But it's very specific. It's not available everywhere in the UK. And yeah, that can be frustrating because you're not always sure unless something is offered to you if it's necessarily available. And of course, sometimes there might be a wait, not always.
Hmm. Yeah, yeah. The
Sometimes
wait is always a bit tricky when you go through the NHS.
it
Yeah.
can be.
Okay.
Yeah.
Okay. Great. That's really, really helpful. Thank you so much.
It's a pleasure. Lovely to speak with you.